Hey, what's up, everyone? It is the Beast, Brian London. Welcome back to the Beast On. The man that is right here with me is Dr. Alon Payenson, emergency room physician, and of course operates the amazing Doctors on Call 365. Check out all that stuff at doctorsoncall365.com. And you may have watched our video from, it might have been a couple weeks ago now, that we did when the coronavirus just started making its way through not only the country but South Florida. And now we're here for an update. And if you want to see more videos like this and get updates further along, please subscribe to the channel. Hit the subscribe button down there and hit the bell so that you get notifications. So, Dr. Payenson, first, before we get into all the other stuff, how are you doing?
Personally doing okay, so thanks for asking. We're hunkered down like everybody else. I'm trying to come up with projects and do what we can to kind of stay safe, and I'm still going to work like I'm supposed to and taking care of everybody and following my schedule. So my life is kind of as usual, but everybody else is staying home and we're following the rules.
All right, good. So talk to us about going to work in the ER that you work at. How has life changed for you as an emergency room doctor over the last couple of weeks?
So, yeah, this is kind of unprecedented territory for all of us. I'm sure everybody's seen the big tent that's outside. So what we're kind of sort of trying to do is keep all the cold, sniffles, runny noses, mild possible COVID cases out in the tent, so we're not contaminating the entire ER. Majority of those people all end up going home, whether or not we end up testing by guidelines for COVID or we don't. That sort of gets done out in the tent. So we're seeing definitely an uptick in people coming in with just mild cold symptoms. Most of them do not end up getting tested because we're following very strict CDC guidelines. But regardless of if we test or not, majority of them do end up going home. The ER itself is not bad. We're still able to take care of all the other patients that come through, our heart attacks, our strokes, our belly pains, everything else that's our usual bread and butter emergency medicine. We are not overwhelmed yet. There's all sorts of projections coming from Italy and everywhere else, so sort of we're going to get overrun, which is still possible. We are seeing an uptick in cases of people we're testing for COVID inside the ER, which makes our ER sort of a hot zone by itself, and we're trying to isolate everybody that we're testing and keeping everybody else safe and putting them in isolation rooms. So we're definitely seeing an increase in that. But other than that, we're still able to care for the community, and it's been okay so far. We don't know. Every day changes, and the rules change, and everything changes daily. So for now, we're doing okay, but definitely people are picking up extra shifts, working more than they've been scheduled for, picking up shifts in a tent, and we're trying to do our best to keep up with everything.
You talk about the testing guidelines and who gets tested and who doesn't. So as of the recording of this video, which is Sunday morning, March 22nd,
right.
What is the CDC, what is the hospital recommending as far as guidelines for who gets tested?
Right. So I think and as you all probably have seen in the news and driving by, CBC Smith is also now testing, or the military's testing there. But they also have guidelines. I recommend everybody checking it out online. I think the news and the print media has posted the guidelines of who actually ends up getting tested. It's still on a case-by-case basis, but for the most part, you have to have contact with somebody who either tested positive or being a healthcare provider with symptoms, because we're at a higher risk. So either healthcare providers are being tested with symptoms, anybody with contact with symptoms is being tested, and anybody 65 and older or has a lot of comorbidities and other medical illnesses that puts them at a higher risk is also getting tested. If you're a 25-year-old that has a low-grade fever and maybe a little bit of runny nose and you have no travel and no contact with anybody who's been tested positive and are not in the healthcare field, chances are most likely you're not going to be tested. So it is dependent on sort of what story you come, as far as what exposure you've had and what field you work in. We're also testing police officers and anybody who's sort of in the front line and has a high risk of exposure. But everything's being case by case. And same thing is happening, I think, in the testing center across the street.
So obviously we want to say, listen, if you have any questions, contact your physician, your healthcare provider. They'll have the best instructions, the best advice for you, so nothing's blanket that we're saying. But let me throw this at you. So, and this is real life scenario. I actually texted you the other day as you were in the ER working on somebody else I knew, but that's a whole nother situation. But I've had a runny nose for 11 days. I've had a sore throat, the normal cold symptoms. I'm a hypo, so I've got my pulse oximeter here. I've been checking that. I've got the temporal scanner for my fever. I'm good there. So I've got like a cold. And that most likely, most often, I would run to my doctor's office and see what he could do. But in this day and age, you don't do that. So what do you do if you're just not feeling great, but it's nothing serious?
Right. So kind of what our party line has been and what most healthcare professionals are saying, that if you're otherwise feeling okay, if in your mind you don't feel like you need to run to the emergency department and things are not that dire and you feel like in any other day and age you had a cold and you would have stayed home, our recommendation is still stay home. From an epidemiological standpoint, yes, we need to know what the true numbers are, and maybe across the street they're testing a little bit more actively. But if you don't have a reason to go to the emergency room, our recommendation is still don't go to the emergency room. That's how we're going to get overrun. That's how we're going to go see a lot of patients that don't necessarily need to be there with runny nose, cough, congestion that are otherwise fine. And we're not a testing center per se. We're still an emergency room, operating as an emergency room, trying to take care of the most critical cases and all the other illnesses that come to the ER. So if you have a runny nose, if you have a cough, if you have a cold, if you're in your head like, oh my God, I might have COVID, 98%, majority of people will do fine. It is still mild symptoms. I actually posted a video on my Facebook site about sort of going through that, what the cases look like, what mild looks like, what moderate cases look like, what severe cases look like.
And where can we find you on Facebook?
Those are on Doctors on Call 365 on the Facebook app or website. So reasons to come to the ER are essentially still the same. People are coming in and say, like, I have to get tested. Again, whether or not we test or not is following CDC guidelines. But again, you don't need to be there unless you're having shortness of breath, chest pain, other emergent conditions, other things that actually require further testing, like blood work, or if you're feeling chest pains or short of breath or belly pains or other things that, again, are emergent. Run of the mill, I have a cold, I have a little bit of fever. If you would have stayed home 30 days ago, it's still okay to stay home. Same rules apply. Stay home, wash your hands, sanitize everything, and stay away from the elderly, stay away from everybody who's immunocompromised. They don't need the influenza if you have influenza. They don't need strep throat if you have strep throat. They don't need COVID. So people will say, I need to know. Well, again, epidemiologically, yes, we should know what the numbers are. But from a infection standpoint, those around us that are older, those around us that are immunocompromised, don't need any of the illnesses that we may have, regardless if it's COVID or influenza or strep or some bacterial bronchitis. It's essentially irrelevant. Because again, most cases of COVID are going to be mild, and most of us are be able to run its course. So if you have fever, if you have a runny nose, if you have congestion, stay home, isolate, wash hands, put a mask on if you're worried about spreading it to others. And essentially stay away from anybody who has a lower immune system or is older.
So in other words, if 30 days ago I didn't think I needed to go to the hospital, don't. And if 30 days ago I felt like, man, I can't breathe, something's wrong, I need to go to the hospital, do.
Correct.
All right, that makes a lot of sense. Where are we? Because I've been reading a lot of stories. We've been seeing a lot of stories on the news about the lack of supplies in emergency rooms as far as N95 masks, PPE, personal protective equipment, all the stuff that you guys as frontline healthcare workers need to keep you guys safe. How are you guys doing with that?
So we're doing okay, but there's definitely a national shortage. We're feeling it. Everything's on back order. We're doing what we can with the resources we have. And that's another reason that, again, if you can stay home and you can ride this thing out and maybe get tested across the street where they're doing testing and everybody's sort of already dressed up and protecting themselves. Because if you come in and we suspect you to have COVID-19, then we have to use, every single person who goes in the room will have to use a PPE. And even if we end up sending you home, we've now used up a lot of resources that, if you were otherwise feeling fine, we didn't really need to. So that's, again, another reason that if you're feeling otherwise okay and are not short of breath or experiencing any major complications and feel like you could do okay with this to stay home. But we do have a shortage. N95s are running low. We're using plastic gowns. You can see the pictures of U.S. Personnel using certain equipment versus what's in China and how they're dressed and how Italy's dressed from head to toe. We don't have that kind of equipment for some reason. We're all scrounging for our own N95s. I had a wonderful person from actually your neighborhood give me a donation of some masks that we're holding on to. We're trying to, I know there's a lot of people on Cooper City Buzz and friends and neighbors that are trying to send us make masks or are trying to get resources to get us masks, which is fantastic. But we are running low. For now, we're okay. But we don't know if we get hit like they did in Italy, then we were going to be in a lot of trouble. Because again, we're trying to protect ourselves, and if the front line goes down, then there's really nobody else to take care of. So for now, we're using a mask all day long. We're using our visors and washing them down, gowns, but there's definitely a shortage, and it is a big worry for all of us.
Speaking of Italy, I think a lot of us have seen the video from that Sky News report where they're in the hospital in Bergamo, where I have a kind of relative that lives there. Luckily, she seems to be okay, but that seems to be the epicenter of the real pandemic in that northern part of Italy, and the scenes from that hospital are just completely scary. Obviously, you guys, it doesn't seem like you're there yet, but, other parts of the country, whether it be in New York or Washington, we're really starting to push the abilities of our healthcare system in some parts of the country to be able to handle this. What's your big picture as far as what is coming, the wave, and can we level the curve a little bit by doing what we're doing now, which is social distancing?
I mean, our training is prepare for the worst and hope for the best. So we'll do what needs to happen, and we'll take care of what needs to be taken care of. As of right now, like I said, we're okay. Most of our overrunning and most of our sort of mass influx has been of the worried well. Our tent got a little bit overrun. Our main ER was doing okay. Thank God we have the tent, then we would have been in trouble. Our tent handled a lot of patients over the last week while the military was setting up their site. I think in one 8-hour period, one of our petitioners saw 65 patients. I guarantee you that probably 60 of them really didn't need to be there. But they were worried, and we understand, and it's a really scary time. And I think most of them didn't get tested either. So we're going to get overrun by the worried well. That was our first worry. That was handled by the tent, and I think the hospital did a good job responding to it. They did not come into the ER, the main ER, and the rest of us were able to manage the load pretty well. As of right now, we're okay. But we're making preparations. What do we do if we start seeing too many cases that need to be intubated? Again, we're not there yet. We're hoping for the best. We're hoping the social isolation works. If everybody does their part, everybody stays home, washes their hands, doesn't go out unnecessarily, follows the rules, stay in as much as possible, especially if symptomatic, especially if you have a runny nose, a cough, a fever, and definitely stay in and isolate. If we do our part, hopefully we can avoid the worst case scenario, which would be what's happening in Italy. Other than that, we're taking steps. Again, we're not going anywhere. We're working extra shifts. We're pulling double duty. We're trying to take care of ourselves. We'll see what happens. The best way to do that is, again, staying home, following the rules. Don't think it's not going to apply to you. It is something that's on surfaces. So you might be feeling fine, and you go and, go to a grocery store and don't wipe down the cart, and then you get it. So the best way to do it is, and if you have to go out, wipe everything down. If you don't have to go out, and if you're having symptomatic, definitely stay home.
Alon, I don't know about you, but I'm losing my mind over these videos we're seeing of, we saw spring breakers at the beach. We saw people celebrating St. Patrick's Day. Yesterday, there was like 1,000 boats out by the sandbar of people partying, and younger people seem to be just saying, "Hey, it doesn't affect me," because the early messaging was older, 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 older. But what we found, I think, in at least in the stuff that I've read, is that 18 to 49 is an age group that can still definitely be affected and impacted by this seriously. I'm following the story of a lawyer in New York who's a marathon runner who's in his late 30s who's now on a ventilator. And that scares the bejesus out of me and should scare the bejesus out of everybody. And I don't know why people can't just heed what is smart advice, just to stay home.
Right. I mean, it affects everybody, including children. It affects everybody. The studies so far are showing that it's the elderly who get the most sick and have the highest mortality rate. But the fear is if you're healthy and an 18-year-old and you can write it out, but you don't know that you have it, then you go to grandma's house and now grandma has it and now she's going to end up on a ventilator. So the spread is from that. And yes, there's definitely, even a 2% mortality or a 0.2% mortality in younger people is still 2 out of 1,000 people. And now we're seeing more than 1,000 cases. So that means that there's still going to be a lot of people that are going to end up intubated, going to end up getting sick. We'll hopefully, through the whole thing, pull through and don't count in the mortality numbers. But again, it's spreading that way. So it can affect everybody, including children. Thank God that they're doing well as far as being able to pull through it and fight it off. And same thing with slightly younger. But yeah, you're still going to hear bad cases. There's still going to be people in the 20s, 30s, and 40s that are sick and potentially have a deadly case and end up getting intubated and potentially even passing away. But the bigger fear is that they are spreading it to those that are vulnerable, and you don't know who's who. If walking in a store, you don't know who's immunocompromised. You don't know who might be taking medications that lower their immune system, who's on chemo, who's on not. And if you're spreading it out to them, then you might feel fine, but they're not going to. So again, if we all do our part, follow the rules, go out only if we have to for supplies and things like that, and not go out with the whole entire family and sort of minimize it. And especially if you're feeling ill, hopefully we can flatten that curve and not get overrun, and we can continue taking care of everybody.
When you're not at the hospital, you're operating Doctors on Call 365, where normally you make house visits, but I think you've been doing a lot more teledocting these days than going to people's houses. But I'm waiting for someone to give you a call. Hey, can you do me a favor and call in a script for the 2 drugs that the president tweeted out there? One is for malaria, chloroquine, and the other one's an antibiotic. And it seems like there's been cases where people are just calling their doctors like, hey, write me a script for these 2 drugs and I'll be fine.
Yeah, I mean, you have to understand that everything is super speed right now. There's never, ever going to be a scenario where two medicines that we've really not studied in this case are being approved within 2 weeks of a few anecdotal studies, maybe a few case studies. This is really not how science works, but we live in an information age where we're passing information pretty quickly to each other, and we're trying anything. So this is a sort of a kitchen sink approach. Yes, we've seen good outcomes, but we're saving that only for that worst cases. We're saving that for the ICUs. We're saving that for our worst affected individuals at this time. It's not something in the community. Again, most of us will ride this thing out. Most of us will do okay. Most of us will have hopefully just a mild cold, maybe a little bit of a worse cold that you've had in the past, a bad flu, but most of us will ride it out and don't need any treatment. Yes, we have treatment protocols, but those are for those that are the worst case scenarios in the hospital, potentially intubated, or maybe we're trying to prevent them from getting intubated. So haven't had that call yet, but that's kind of the recommendation we have is that let's save that for everybody who truly needs it. Everybody else, do your part, wash your hands, stay home, drink fluids, take some Tylenol, and should be okay.
All right, before I let you go, and I appreciate you taking some time on one of your few days off with your family, what's a message you have to us here, not only in Broward and South Florida, but anyone from around the country that may tune into this video? What's the overlying message you'd like to get through as a healthcare provider that's on the front lines every day dealing with this?
All right, so number one is, again, it's been played over and over and over, and I think I mentioned it more times than I should have, but it's staying home, especially if you have symptoms. Let's follow the rules. They're in place for a reason. We're trying to minimize the spread, trying to protect our vulnerable population, not get our hospitals overrun like we see in all the news media everywhere in different countries. So, A, if you don't need to go out, don't. There is a blessing in disguise. We can spend more time with the family. We always say, I wish I could have dinner with the family. I wish I could be home. Well, now we have. Especially if you have symptoms. If you have symptoms, runny nose, cough, congestion, fever, feeling under the weather, there's zero reason to go outside. Regardless of what infection you have, you don't need to be outside. Somebody else can go get it. Whatever it is can wait till you're feeling better. And the other thing too is we've seen a lot of people that come like, well, I need to be tested. I have a fever. I have a cough. Again, from a number standpoint, that might be true. From a treatment point, the best thing you can do is stay home. Regardless of what you have, if it's influenza, bronchitis, pneumonia, even if it's COVID, it doesn't need to be spread around. The rules are the same. Stay home, wash your hands, wear a mask if you need to, stay away from elderly, stay away from spreading it to others or anybody else who's immunocompromised. That should be true even in flu season. We've never really expressed it like that, but that should be true at that point too. And last one is, again, if you're short of breath, if you have chest pain, if 30 days ago you thought to yourself, I should go to the hospital for this, it's true now as well. So if you're having bad symptoms, you can't take more than 2 or 3 steps without getting short of breath, and normally you can run a few miles. If you're having crushing chest pain, if you're having belly pain, if you have any other symptom that, again, you thought to yourself that this is something I should go to the emergency department for, then come. We're here, we're open, you're still taking care of everybody. And please utilize all our other resources, not necessarily me, but Memorial Health, Baptist Health, your insurance companies, primary care doctors, everybody's available for telemedicine. If you have questions, call. And you have questions about testing, Brian can put up the hotline. There is a national and I think a county hotline. Call them, see if you qualify for testing. If you want to do that, the military is doing a great job in conjunction with Memorial. And you can get tested that way.
All right, I have one last question, and I don't want to hit you with something so serious to end the video, but how are you doing on toilet paper supply?
So far, so good, but I think that's going to become the new currency. I'm wondering how much, if I can get a sirloin or a T-bone, how much toilet paper and how many rolls would that cost me. I think we need to start looking at, what's the value of toilet paper, what's the value of sanitizer, what's the value of Clorox wipe, and start making that monetary.
Yeah, instead of Bitcoin, we'll all invest in sanitary currency.
Yeah, I think, I can trade. We can make some trades. Depending what I'm running low on, what everybody else has, we can start bartering. I think that's the new way forward.
Yeah, no doubt. Dr. Payenson, thank you for taking some time. We appreciate you. Thank you for everything you're doing for this community. We really appreciate you and all of your fellow healthcare workers, those of you on the front line that are really putting yourself at risk in order to treat us and make sure that we get better. So thank you so much.
No problem. It's our pleasure. It's what we do. And again, we'll keep doing it as long as we can.
All right. Thank you, Doc.
No problem.
That's Dr. Alon Payenson. He's an emergency room physician here in South Florida. Also operates Doctors on Call 365. You can find him doctorsoncall365.com, the Facebook page, the Instagram, all of that stuff. And we appreciate him for joining us here on The Beast On. And please subscribe to the channel for more content. Dr. Payenson, thank you, and we'll see you next time.
Thanks for having me on.
Will do.
All right, bye.